You are listening to Thrival Nutrition Podcast, episode 70. Welcome to the Thrival Nutrition Podcast with me as your host, Lahana Vigliano. We talk all things holistic living, real food nutrition, fitness, herbs, essential oils, and so much more. I'm here to make your holistic lifestyle simple, easy, and fun for you and your family. I am beyond thrilled that you are here. So let's go over and hop over to today's episode. Happy Tuesday, you guys. I am stoked to have Dr. Megan Ding on the podcast today. She is going to be talking about natural cancer support, and it's just something near and dear to my heart because the cancer rates in this country and world is just, skyrocketing, and it's such a heartbreaking thing to watch, whether, it's an elderly person, maybe it's a child, maybe it's middle-aged, whatever it is, it's something that no one should ever have to go through. And Megan sharing her niche on being a naturopathic doctor and just making this one of her niches, one of her passions, really inspires me. I feel like there's more functional medicine doctors and naturopathic doctors that should specialize in this, and they are out there. There's doctors out there like Megan that, if you have cancer, it's someone you should definitely be working with. So we're going to be talking about pretty much that natural cancer support. We're going to be talking about the foods and the herbs and the different things that you can do to your body if you have cancer. These are even things that you can be doing right away before anything even happens. And so no matter where you are in life, this is just something that you need to learn, you need to know, and also share with your friends and your families that also may be struggling with it, because I know cancer strikes almost in everyone's lives, whether we know someone in our family or our friends that are diagnosed with it, and it's heartbreaking. So I'm so excited to have Megan on. She covers a lot, and she has tons of good information. So before we get started, I want to make sure that you guys are inside my Facebook group, just to make sure to just contribute to the community, even if you don't want to contribute and ask questions or answer people on their questions. Even just being there and just kind of like seeing everyone else's answers. I know a lot of people in Facebook groups are silent. I have so many Facebook groups in that I'm silent, but I just watch and read, and some of them are really, really entertaining. Usually though, that drama in my group is stayed to a minimum to, if there's any. So please go in the show notes. There's a link to go join it. I'd be really excited to have you there. We're just kind of getting on track of, the big move, and we're doing awesome. So nothing too new in the personal life, but let's just go over and chat with Megan. I'm super excited for you to hear this information, to hear this niche, that passion that she has for this. It's really awesome, and I promise it could be life-changing. Hi, Megan. Thank you so much for coming on the podcast this week. How are you doing?
Good. Thank you for having me.
So I'm very excited to have you on, because this is definitely a topic that throughout, I just started the podcast last year, and I don't know why I haven't touched on it, but when I found you online, I really thought you'd be the perfect person to kind of pick your brain on this topic. So let our listeners know who you are and what you do.
Great. Well, I'm Dr. Megan Ding. I'm a naturopathic doctor at Charlotte Nuvitru Wellness in Charlotte, North Carolina, and I have a general practice seeing patients with all kinds of health concerns, but my passion is working with patients who are dealing with cancer. So I see them before, during, and after active treatments, and I see them in survivorship or in prevention mode as well. So pretty much just a general practice and focusing on cancer.
That's awesome. What kind of brought you into having your passion to work with people that have cancer? Did you have a personal experience, or maybe something you learned about it in school?
Yeah, so what really brought me to naturopathic medicine was at a young age, I saw my aunt who dealt with ovarian cancer, and what she did was she did the conventional treatments, chemotherapy, radiation, and then she also combined that with naturopathic medicine, doing nutrition a lot, and Gerson therapy, and some supplements here and there. So that really brought me to naturopathic medicine, along with my own health concerns, and I decided to pursue it. So I geared my whole entire medical school career towards seeing patients with cancer, doing different internships around the country at Cancer Treatment Centers of America, and different preceptorships and mentorships with other naturopathic doctors who have a passion for cancer as well.
That's awesome. I feel like this passion, this niche is so important, and I feel like there needs to be more of you out there, and I'm sure there is, but I love it too. I love reading about cancer. I obviously don't like cancer itself, but it's very interesting to see what the body can do and what it does, and obviously the body's, natural ability of trying to heal, and so it's really fascinating to me. I totally agree with, this niche. I love it. So I'd love to hear your thoughts, coming from a naturopathic doctor, of what's exactly going on inside of a person's body that has cancer, like on a cellular level. What's happening?
So on the cellular level, what I target as is more of decreasing the rapid replication that's going on and decreasing this blood supply that brings even more nutrients to a tumor to help it grow. And so what my focus is more on, not the cancer itself, but more so nourishing the body. And I always think of cancer as this weed that we have in our garden, and the garden is your body. And so to enable to stop that weed from growing and more weeds, we really need to take care of the garden and tend to it so that the weed doesn't grow anymore. So on the cellular level, we're looking at the replication and blood supply, and there's different things you can do, especially changing the nutrition and some certain supplements with that.
That's awesome, and we're going to go into that too. Is there any, books that someone could read about? Obviously not a school book, but a book that's out there. I know that I've read The Truth About Cancer. I'm not sure if you've read that one. It has a black cover. I forgot the name, the author, but do you have any recommendations?
Yeah, so the biggest one that I always recommend to patients is Radical Remission by Kelly Turner.
Okay.
And it's a great, easy read for patients, and it doesn't go into scientific things about cancer, but more supporting them emotionally and physically and spiritually. So it does take them through different concerns that they have with their cancer diagnosis, and then also addressing the emotions around it, and having actual action steps for them to take and practice on a daily basis. The other book I really recommend is the Anti-Cancer book, and this is by, David Schreiber. Yes. So David Schreiber, and he was a doctor who dealt with his own prostate cancer, and he really talks about how nutrition and your environment really affects it as well. So those are two great books I love.
That's awesome. Okay, I'm going to put those in the show notes to make sure that people have a link if they want to get them. What are the natural solutions that you provide, like you said, in addition to whatever treatment that the patient decides to take? Why is it important to use this natural support, and what do you use?
Yeah, so to me, what's so important about the natural solutions that I provide, which is the nutrition and supplements, is that it really does make the treatments that they go under even better. So we're enhancing the effects of those treatments, but we're also subsiding any side effects. A lot of times you see the side effects of these active treatments like chemotherapy and radiation. It has a lot to do with malnutrition, fatigue, nausea, diarrhea, and those are very easily subsided with nutrition when you have those in place going into those treatments. I mean, unfortunately, the biggest one is, you have nausea and diarrhea, so then you're not eating and then you're malnourished, and then, you oftentimes it's not because they're dying from the cancer, but it's dying from the malnutrition. Yeah. So having that in place, a lot of times I see my patients just, people are experiencing none of these huge side effects, and a lot of times their friends and family are like, are you even doing any treatments? What is going on? Because they're just going for their treatments and handling it much better.
That's awesome. That's really awesome.
Yeah.
We can get into the specifics of what, I guess, what is your favorite, like, at least 5. I know there's a lot, but at least 5 cancer-fighting foods that you would recommend.
Okay. So the biggest ones are berries, I think, is a really well-known food group, just because of their high antioxidants. And you think of, what foods can have the highest antioxidants, and the simple one is if it can stain your shirt, it probably has the highest antioxidants, which berries are huge stainers. So they provide a lot of nutrients that are cancer-fighting, that reduce any free radical damage that's going on in your body. Another one for me that I don't think gets talked about a lot is mushrooms. And they do about the same thing as berries, but they even go beyond by modulating your immune system. Oftentimes we see that your immune system is not on high alert, and that's why cancer can grow, because they were killed off by your own immune system. So we want to up that up, and when patients are going through cancer. So favorite mushrooms can be arranged from the the white button mushrooms all the way to like shiitake and enoki. And there's so much research around mushrooms, especially in Japan, just because they're so widely used, and that they're even using them in the hospitals while patients are going through chemotherapy and seeing much better results. So that's a huge one. I don't think we have that enough in the American diet.
Yes, definitely. And I know reishi is one of them too. I actually take a reishi supplement because, mushrooms and their taste. That's like one vegetable I could just never eat. I don't know why, but I do make sure to take them in like at least a supplement form.
Right, yeah. So there's so many more supplements coming out in the mushroom world, just because the research, I think, is coming out much better. And then there's also... let me think. So another one that gets talked a lot about is turmeric and green tea. So those two work, I think, very similar in a way. They're high in antioxidants, anti-inflammatory, so we're bringing down the inflammation that's going on in the patient. And then also they are really great at stopping certain signals that cancer cells put out to bring more blood supply. So it's also another component of that cancer-fighting foods is that we want to stop the blood supply to the tumor so that it doesn't grow even more.
Okay, that makes sense.
So kind of cut off its nourishment. Yeah.
How much green tea do you think someone would need to drink, I guess, to feel like really good effects? Because I heard that it's definitely more than one, but is it like a abnormal large amount?
It's a pretty abnormal large amount. I mean, we're talking about at least 5 to even 10 cups, certain studies will show. Yeah, so it's a lot. And so oftentimes I'm saying, well, we're thinking about, how much patients are drinking, how much water they're intaking. So you can kind of add that into your water intake. And then also you can drink it, make a huge pot and then just drink it throughout the day, kind of deal. So not really. But then that's why some supplements kind of come into play because, patients can't really get that all in one day every time and think about it. So
right, yeah, definitely.
Yeah.
So that's funny that you said staining of the fruits, going back to the berries. I've never heard of that, but that's actually a really good little easy tip that people could use.
Yeah.
So I'm guessing beets would definitely be one of them.
Yeah. It's kind of like why beets are now used for high blood pressure and all with the antioxidants. So.
Okay, yeah, beets are definitely, I feel like, the most vegetable fruit that just stains. I don't know, I can never get beet out of my fingers for days. Yeah, I mean, beets too is when people eat too much beets, they're like, oh my gosh, my soul is too red now because of the beets. So there's some patients get a little shocked by that and it's like, no, that was the beets. It's okay, nothing's happening. So. That's so funny. I actually have never had that happen to me. Maybe I'm just not eating enough of them. Do you have any other foods?
Yeah, I think the usual things. Let me think. Oh, the one big one I like to use for hormone sensitive cancer. So we're talking about hormone sensitive, like prostate, breast cancer, ovarian cancer, are cruciferous vegetables. So cabbage, broccoli, cauliflower, bok choy, collard greens, kale. Even those have really high amounts of indoles and sulforaphanes. They also have high amounts of glutathione, which is like one of the biggest antioxidants you can have to help your liver digest things.
You're so good at pronouncing those words, way better than I am.
I actually just did a talk on anti-cancer foods like last week at a local breast party here.
Nice.
Yeah, so
yeah,
had to practice those.
What do you feel like is probably the most inflammatory food that someone could eat and probably shouldn't eat when they're dealing with cancer?
The biggest inflammatory foods to me are sugar and carbohydrates. And carbohydrates essentially because they are sugar filled. There is the debunk in the myth that sugar doesn't feed cancer, but does sugar really do feed cancer? It's, you need sugar to energize your cells, but you don't need that much sugar in your body and to actually feed the cancer. And so, there's a certain amount of sugar in your body that you need, but you don't need, those indulgences in your life. And then you look at a donut versus an orange. Your orange can provide so many phytonutrients along with that sugar, and you're getting fiber and all kinds of other things, versus a donut, you're just getting sugar. So
right,
it's a different way that your body processes sugar.
Right. Yeah, it's funny that a lot of people don't realize that carbohydrates do turn into glucose sugar after you eat it. So a lot of people be like, yeah, I don't eat much sugar. They're thinking like candy and like, sugary things, cakes and stuff. But I was like, yeah, even like a bagel. Yeah. A bagel is pretty much sugar. Right. You can think of it like sugar. So you have to like put that in their head like, no, that definitely counts as sugar.
Yeah.
What are some of your favorite supplements? I'm going to say supplements / herbs, kind of the same thing, that you find cancer fighting, or even some that are protective. Even if someone doesn't have cancer, what's something that they could use?
Yeah. So the biggest herbs, again, if you're taking them supplement-wise, would be curcumin from turmeric and then ECGC from green tea. Those are my big favorites. I also use DIM a lot, which is the chemical component from cruciferous vegetables. So you see a lot of these supplements that I use are actually coming from foods, but because we're dealing with cancer, we just need them in a higher dose, so you get them in supplements versus foods. For cancer prevention supplements, I like to use fish oil is really great because we just bringing down any inflammation that's going on in your body. The biggest one, the supplements that I use for cancer fighting is melatonin.
Really?
Oftentimes we see, yeah. So, and this is a dose that is at much higher than the usual for sleep aids, which is like 0.5 milligrams to 3 milligrams, maybe even 5, that you see with some people taking it for a sleep aid. Right. But a lot of research has shown that it's cancer prevention at 20 milligrams.
Wow.
Just because oftentimes you see a higher rate of cancer when patients have a poor amount of sleep. And so when you're thinking about it, the lack of sleep, promotes cancer is because during your sleep, your immune system actually is regenerating. And so it's becoming more high alert. And so with that lack of sleep, your immune system is really down. And of course, you are tired all day and other things come about with other concerns. So there's tons of research where, night shift workers have high amounts of cancer in their population. And certain cancers like breast cancer is a big one that they've seen that melatonin really help provide some assistance with reducing risk. So.
Oh, that's interesting. I've actually never heard of that, but that totally makes sense. Sleep is a huge thing, a huge factor in your environment that obviously contributes to your health. And I know that genetics is also another one, but I feel like with genetics, I'd love for you to kind of talk about like gene expression, because I know that even though you have genetics, you maybe a certain what's the one I'm trying to think of for breast cancer? You might have to.
The BRCA?
Yes, that one. I was like BR something. But some people think that's like just the end all be all, and they are going to die of breast cancer. So I'd love for you to talk about a little bit about gene expression and how it's not your death sentence, even if you do have a genetic, dysfunction.
Yeah. So when it comes to genetics, there are a lot of people out there with the BRCA 1 or 2 that they know of with genetic defects. And our DNA, we're born with our DNA, but how it's expressed, it gets into the epigenetics of health. And so there's a lot of research showing that we are born with a set of DNA, but how it's expressed is going to be different. Whether or not our environment has a huge play into that, our diet, our lifestyle, whether we're exercising or not, a lot of things play into how our DNA expresses and actually can change our DNA expression. So you see a lot of times patients with these genetic defects thinking that, okay, they're going to get cancer, and they don't. And then you see a lot of patients who have absolutely no breast cancer history in their family and do express breast cancer. So definitely our environment plays into our DNA expression.
Definitely. And I'm so thankful for the work that you do, because it definitely needs to be out there, and people need to know that they have options, and that even if they do decide to do, chemo and radiation, that there's ways that, you can support your body. And that's like working with someone just like you. So let our listeners know where they can find you. What social media sites are you on? What's your website? Things like that.
Yeah, so my website is www.drmegan.com. It is drmeganding.com. You can also find me on Facebook and Instagram with my name, Dr. Megan Ding. And so it's really about empowering the patient. A lot of times you can't determine your chemo, radiation, or what the oncologist is telling you what you should be doing. Definitely ask your questions and be your own advocate. But what you put in your mouth plays a huge role in your health, and so you want to empower yourself with that.
That's awesome. And you see online clients, right? Do they have to be in person in North Carolina?
No, they don't. So I can see patients online through Skype or Google Hangouts, and then when it comes to supplements, I usually just ship them out through my office. So
awesome, easy peasy. Gotta love technology.
Yeah.
Awesome. Well, thank you for coming on the podcast. It's been a really pleasure talking to you.
Thank you.
The contents of this podcast are for educational purposes only. This information is not intended to replace a one-on-one relationship with a qualified healthcare professional, and it is not intended for medical advice. This is the sharing of knowledge and information from education, research, and experience. I am not a registered dietitian or physician. I encourage you to make your own healthcare decisions based on your research and partnership with a healthcare professional. Thanks for tuning in. I'll see you next week.